Bipolar disorder, a brain disorder that causes unusual shifts in mood, energy, activity levels, and the ability to carry out day-to-day tasks. People suffering with bipolar disorder will shift between episodes of mania, characterized by long periods of jumpy, overly happy or irritable moods, and episodes of depression, characterized by extreme feelings of emptiness, worry, loss of interest, and thoughts of suicide. In the fourth edition of the DSM, bipolar disorder is classified within Axis 1 under mood disorders. It's divided into two major forms: bipolar 1, the more extreme form with impaired judgment and delusional thoughts, and bipolar 2, a mild to moderate form with experiences of hypomania, a less destructive state than full-blown mania. One well-known person suffering with bipolar disorder is the music artist Demi Lovato, who was diagnosed after attacking one of her dancers during her tour.
I literally was so emotionally whacked out that I took it out on someone that meant a lot to me. I had no idea that I was even bipolar until I went into treatment. When I was 7 years old, I started having actually suicidal thoughts. Looking back, I'm like, okay, that makes sense. Like, I was bipolar. I was actually manic a lot of the times that I would take on workloads, and I would say, yes, I can do this, I can do this. But then I would come crashing down, and I would be more depressed than ever.
In a study published by the Archives of General Psychiatry in 2011, it was shown that America had the highest bipolar disorder rating than any of the 11 countries that were analyzed. Although bipolar disorder has been proven to run in families, this study confirmed that environmental factors do play a role. In America alone, bipolar disorder affects approximately 5.7 million American adults per year, which is about 2.6% of the US population over the age of 18. The average age for diagnosis is 25, but it is still possible to only start to show signs later in life. It is also becoming more and more common to be diagnosed during childhood. Although males and females both have around the same chance of being diagnosed for bipolar disorder, the two genders experience the disorder differently. Back in 2013, a random sample of 461 men and 629 women with bipolar disorder was studied. It was shown that females are more prone to depressive episodes, while men are more prone to manic episodes. There are several types of medication used to treat the disorder, but mood stabilizers like lithium, Depakote, and Lamictal are the most common. Some of the side effects are restlessness, muscle tremors, loss of bowel control, seizures, and hallucinations. Other forms of medication used are antidepressants like Prozac and antipsychotics like Abilify. Side effects of these medications include blurred vision, weight gain, nausea, insomnia, and anxiety. Several forms of psychotherapy can be used to help treat people with bipolar disorder, like cognitive behavioral therapy to help people change harmful and negative thoughts, interpersonal therapy to improve their relationships, and psychoeducation to help people spot the signs of an impending episode and get help before it's full-blown. The overall success rate of bipolar treatment is around 80%. Although there is not yet a cure for bipolar disorder, the proper combination of medication and therapy can allow people with it to lead functional, productive, and fulfilling lives.